doing deep tissue laser therapy for people that do a CrossFit workout, it's extremely helpful. And you can see from the hands here, one of the things that you'll get from doing many of the different types of workouts, from the rope to the kip ups to kettlebell snatches, is you get a lot of wear and tear on the hand, maybe even get a soft tissue wound injury, and the laser is going to be very helpful for that, to help accelerate the tissue repair and regeneration, but also help if you have sore fingers or wrists. I'm actually going to do a little laser treatment on here and talk to him a little bit about how this injury happened for you, because you're a level 1 coach, right?
Yes.
And this is something that's very common in people who do some CrossFit workouts, right?
Yeah, specifically the pull-ups. I see that more often than not, the pull-ups are going to tear the hands up, and it's normally due, like in my part here, it's poor hand maintenance, poor callus maintenance.
So even when you do everything right, sometimes you're still going to get injuries with that too, though.
Yeah, you're going to develop calluses. You need to maintain them properly, and I just kind of failed to do it, and then jumped into a workout and didn't even think about it. And
well, that's where the laser comes into play, because if you don't have a wound, you can use the laser to help with that maintenance on your hands, to help the calluses. So if you want to use the laser to help heal an area that has been damaged, that's great. But if you also want to use it on there to try to help prevent an injury from happening as well. So this is a case in part where I would have a CrossFit athlete before they train, or especially if they're going into a competition or trying to get their personal best, to laser the wrist and the hand. They get the feel of the laser in the hand and the blood circulation, and increase the mobility in the hand. Feels good, right?
yeah, actually it does. It's tingling.
Yeah. All right, so now we're going to tape the wrist and the hand after we've done some laser treatment. We're going to measure a strip that's going to be able to go around the hand and up in the forearm a little bit. We're going to fold it in half. You're going to take your scissors, you're going to cut a very small piece right out of the center, not big at all. Just a little bit, like that, okay? And then when we tear it open in the center, we're going to have a nice little hole in the middle, okay? And then that's where the middle finger is going to go. So if he opens up his hands, it's going to go right down the middle from here. Then I'm going to lay this tape down. He's going to bend his wrist this way, stretch the tissue, go up into the wrist. So you see I'm getting some protection in the hand, some stabilization in the wrist. He's going to turn over. And now I'm going to put the tape down here. And then now he's going to bend his wrist like this, and it's going to go up the back. Okay, and you can go further up under the arm if you want to. So that's one piece. And now we're going to put another piece here to go across and over to the thumb. And it's going to go right through. Now this is going to be a little bit of a different angle. It's going to come over to the thumb, wrap around and hug the thumb, and I go over and hug the thumb the other way, like that. So you got some stability in the thumb and the hand. And now what we're going to do is we're going to lock this in with a wraparound piece. So he's going to make a fist. He's going to put his fist out towards me like that. So the wrist is locked, okay, to secure the wrist. I'm going to take a decompression strip, put it right over the end of the wrist here, wrap around and wrap around. It's almost like the boxers use when they're putting on their gloves. Okay, so now he's got some wrist stabilization, some hand stabilization. If you look over here, now he's got protection for his hand, but he can freely move his fingers. Okay, so he feels the difference, and it almost gives you a sense of a little bit more power and stability. So when he goes and he does the kettlebells or the pull-ups, he's going to feel a lot more protection.